and welcome to Just One Thing for Parents, where I interview experts on topics related to child and adolescent well-being. I'm Bettina Honan. In this episode, I had the privilege of chatting with Dr. Anna Hutchinson, who is a clinical psychologist with expertise in adolescent development, amongst other things. And in our conversation today, we discuss the complexity of identity development through these pivotal teenage years. Now, it can be a roller coaster of a time. It's marked by change, by experimentation, and there's often a lot of confusion. So we tackle some of the hot topics, including gender and sexuality, which we know is something that teens today are questioning and exploring more than ever before. And Anna guides us through what to do when a young person presents a new aspect of their identity to adults, how to approach these situations with care, with understanding, and with an open heart, and to guide them through these often uncertain times. So whether you're a parent, an educator, or you're just simply fascinated by the journey of growing up, this episode is for you. Here is my conversation with Dr. Anna Hutchinson. So good to have you today, Anna. Thanks for coming on.
Lovely to be here. Thank you, Bettina.
So the question for you, what is just one thing parents can do in discussion with their teens about their identity?
What I think is really important is developing a positive stance, a sort of a way of being when we have those conversations with teenagers about identity. So what do we know about teenagers? We know, the big theorists in psychology and psychoanalysis for many years have always talked about adolescence as this process of change, of exploration, of a real focus on identity formation, trying things out, confusion versus identity formation. So we know that this is what adolescents do. And we know that actually being confused in adolescence is part of the job, really. That's right. Part of the process. So when they come to us and they might ask questions or they might tell us about aspects of their identity that they're exploring, we will not be able to be certain in our responses to them. Just as they won't be able to be certain, neither can we be certain about what aspects of their identity are going to continue through adolescence into adulthood and which aren't, which are a process of exploration that will be left behind as they grow up. So
when you say identity, just for parents, what are we thinking about? Like trying a vegan diet, a different hairstyle, those kinds of things? What other things would you?
Well, it could be any of those things, couldn't it? It could be. It depends on the young person. I mean, the zeitgeist at the moment for the last sort of decade, working with young people, has been talking a lot about sexuality, about gender identities in adolescence. So we're certainly seeing that coming into the clinic room a lot, with young people and parents. But, one of the most important things, I think, is keeping a really broad view of your child's identity and helping them to do the same. So, helping them develop identity in relation to academia, in relation to their peers, in relation to things they enjoy doing, maybe music, gaming, whatever it is.
Yeah.
So helping them, regardless of what specific identity questions they might have, keeping a broad view of all the aspects of your young person is really helpful.
So they're almost coming with this idea of, am I an academic kind of person? Am I somebody who, I don't know, am I a really social kind of person? Is that what you're saying? These are the identities?
Yeah. Increasingly, there's data that shows that young people are questioning their sexuality and their gender more than ever before. Huge numbers of young people are in adolescence identifying outside of, what we would have thought to be mainstream in the past, so outside of heterosexual or what's called cis identities. There's a real emphasis on identity exploration in adolescence in our culture at the moment. So that's, really what we're seeing. But young people can bring any aspect of their identity to us, I think I'm going to be a vet,
Yes.
things we hear and sometimes they're questioning, sometimes, young people who may be identifying as being really bright and really academic. And what does that mean for their identity when maybe they don't get the grades they want? Or, it really is the bread and butter of adolescent work, I would say. Mental health as well can disrupt how people view themselves. So we often work with it in relation to that as well. But going back to what I was saying, stance, given all of that, the stance that I encourage, well, clinicians and parents to take is this position of safe uncertainty, which comes from the work of Barry Mason, who's a family therapist. And this is about acknowledging no one can be certain about identity. It can always be in flux. Some aspects of identity do persist, some don't, but we never have, that crystal ball to know how we're going to feel or how our young person is going to feel in the future. So given that uncertainty during this period of adolescence, which is itself uncertain, how do we help them feel safe? And that, that phrase contained. Perhaps they might explore who they are, who they're going to be, what they like, what they don't like, what the future is going to hold for them. So when we're anxious, we often have a tendency to seek certainty to make us feel more safe.
Yes. So if a teenager came to a parent with an identity that was a frightening identity, maybe to the parent, a new idea or something that they really didn't like the idea of, then what you're saying is, rather than reject it or embrace it wholeheartedly, what we need to do is just allow space for that exploration and see it as an exploration.
Absolutely, yeah. So, because I think we can, both young people and parents, when having these conversations about identity, can find themselves in very certain positions. And sometimes they're aligned and sometimes they're not aligned. And I think the only truth that we can all agree with is that we're always changing, everything's changing, and we just don't know what the future is going to hold for these young people. So trying to help, I guess, the parents acknowledge that they don't know, they can't know. And perhaps none of us can know, none of us have absolute knowledge. And the parents bearing that and modelling that for their child will allow for hopefully different, rich, warm conversations to open up where, attachment rich, where parents and young people can be aligned together in exploring ideas, exploring, how this young person ticks, what's making them, happy, what inspires them, what troubles them.
Right.
Rather than getting stuck in a certain position, you're this person or that person, or you're not this type of person.
It is this idea that you're very certain about something, but particularly in these teenage years, that is changing. Its identity is in flux. It's part of that process that they're going through.
Well, this safe uncertainty. It may be in flux, it may not be.
Right.
We just don't know. So aligning with anything in a certain way just limits our options for being open and explorative, Yeah, a good example from my clinical work was this young man who came out to me as gay at about 14, and he was really, really troubled about it. And we spent lots and lots of time exploring it, thinking together about, how he might tell his parents what his future life would look like. And I really aligned with him and affirmed and said, this is fine, this is great. And a few years later, he had to come back and come out to me again as actually heterosexual. Right. And it was so painful for him,
Wow.
And it really taught me, we need to always treat these things with a lightness of touch, absolute respect for where that young person is, but lightness of touch about where it's going to go. And in fact, probably a better way to join with our young people, using an attachment frame again, is to explore so we're exploring this aspect of your identity. How's that leaving you feel? How are you feeling about that? And then going into the feelings, really. So regardless of the identity, connecting with the feelings that this leaves the young person with and working at that level can be really helpful, I think.
Wow. So in that conversation, I noticed the word you said, affirming. Can you just say a little bit more about that?
Yeah, I mean, as therapists, we try and affirm the worth and value of all of the people we work with, don't we? It's really important in a warm, attachment-rich relationship to do that. But in the clinical literature, in the therapeutic literature, affirming therapy was originally developed for, it was developed sort of in the 70s and 80s for working with gay, lesbian and bisexual people. It's a kind of reparative approach to what had been a pathologizing approach before that.
Right.
So that's where that word comes from clinically. And more recently, we've seen it being applied to trans communities, people questioning their gender identity as well.
I see. Okay. So affirming means kind of agreeing with it wholeheartedly. And what you're saying is that may not be helpful, because in the case that you gave, you know, a person said, this is my identity. And that was a big statement to make. But then it was hard for that person to come back later and say, actually, I think I was wrong. So if we allow space and don't do that strong affirmation, that prevents them then later having to come back. And
but we do want to affirm them, and we do want to affirm that it's important and significant. So we've sort of, myself and colleagues have developed this phrase of affirming, not confirming. This is okay.
I like that.
Yeah, it's nice. Yeah. It's okay if this is who you are forever. But it may not be who you are forever, and that's okay too.
Yeah.
And Barry Mason, actually, who developed the concept of safe uncertainty, he also introduced this lovely phrase, authoritative doubt. Yeah.
Oh, nice.
which is where you feel safe enough to not know, essentially. Which again, I think is really important when we're working with teens and adolescents. To admit, as clinicians, we don't always know. The authoritative doubt position is really good, though, because it isn't about collapsing into a not knowing position. And it's not denying that we have any knowledge. You know, so the authoritative bit is, well, we do know a few things. And you know, as adults, we can perhaps help young people with some of our knowledge and our, hopefully, wisdom. You know, even if we're talking about topics that we don't know much about or that we doubt, that we're uncertain about.
Yeah, I really like that authoritative doubt. And all along validating the young person's feelings and saying, I take your feelings very seriously and I want to understand them, and let's unpick them together, and giving that, you know, what Jane Gilmore and I would always call that conversation space, putting all the jigsaw puzzles out, you know, like a jigsaw puzzle, and helping them to work out and problem solve what's really going on for me.
Yeah, because I think often, I don't know if you're seeing this in your work, but we're seeing adolescents who are living lives that are very different from the lives that we led at the same time. And there's online communities, and young people come to us with words we're not familiar with, concepts we're not familiar with, knowledge, you know, a knowledge base we're not familiar with. And it can be very easy, I think, for us as adults to feel quite de-skilled and not knowing in an unsafe way, perhaps. Actually, I really encourage clinicians and parents to remember, we do have something to bring to the conversation. These young people who are so smart, so sorted often, so clever, you know all these things that we don't know, they still need to have a secure place to go and question and maybe sometimes seek guidance, you know. So we still have that role as parents.
Yeah, even if we don't know the answers.
Yeah, absolutely.
And we often won't know the answers.
That's fine.
Oh, that is such fantastic advice. Thank you so much, Anna, for coming on today. And I really hope that's helpful for parents.
Lovely talking today. Thank you.
Thanks.